Hi, this is Beverly Canada once again with a speech for my public speaking assignment, and today I'll be doing a persuasive speech on a do not resuscitate order. I only have one audience member today. The flu is in my house and I don't have any family in the city, so I don't have anyone that can come and enjoy our flu house right now, so it's just me and my husband. But I'd like to talk to you about DNR, which is a do not resuscitate order that is a advanced medical directive that a patient can decide if they want in the chance of a terminal illness, or a family member may decide that an elderly family member can be made a do not resuscitate patient and will not have CPR performed. CPR is often viewed as a quick fix to a medical problem, such as if the heart stops in cardiac arrest, or if a patient stops breathing in respiratory arrest. But CPR is actually extremely traumatic to the body. It does break ribs. It can break your sternum, which runs down the center of your chest. The broken ribs can puncture your lungs and can cause severe, long-lasting problems and severe pain for the patient also. The University of Florida actually defines a DNR as a physician's order that instructs healthcare professionals that a patient is not to receive any or only very limited resuscitative efforts in the event that the patient's heart stops beating or the patient stops breathing. So you may ask, why or who would need a DNR order? And actually everyone that would consider a DNR does have elderly patients, or elderly parents or elderly grandparents that may have a terminal illness or become incapacitated in the hospital and need other people to take control and make their medical decisions for them. So the DNR, what it boils down to, is not performing CPR. So you'll still receive medical treatment. It does not mean do not receive medical treatment. It just means do not perform CPR. So all other medical treatment will still be provided, which is often misunderstood by people that think a DNR means do not treat with any other medical devices or medical procedures. So it is very important for terminal patients that decide that they prefer quality of life over a quantity of life, which means that CPR may prolong a life, but if you don't have quality of life, then CPR would not be needed. If you have a very poor prognosis, which would where you would endure a lot of pain and suffering. And CPR may be very extreme, provide longer life but poor quality. The Walton Law Firm states that patients can survive after CPR with extended life support, but also have increased brain damage. So that is another reason why many people agree to pass away peacefully with no unnecessary medical procedures, which would be what we call a natural death, where when the body gives out, it's accepted as death and no more medical procedures are done to try to extend life. There's even the aspect of hospice care, which can also make people more comfortable in death. Lifepedia addresses the question of a vegetative state. So a DNR should be placed into effect before a medical state is so severe where that option can't even be considered by the patient. And then that way organ donation can be performed and quality of life is preserved. And some patients that are not able to decide whether or not they want to have life prolonged with CPR have family members that must decide for them. So family members may feel very guilty about making this decision, and it may affect their feelings of how they accept death, but it's really a consideration of, will this benefit the patient, not the family members. So the DNR is considered an advanced directive that can describe how a patient wants to die and gives them the power to decide when and where to die peacefully without any extensive medical treatment. Thank you.